Hello guys, it's Dr.A. Jami. You are watching liver pathology series. So far we have covered about acute liver failure and liver cirrhosis. Now today's our topic is about alcoholic liver diseases. So let's moving to our lecture. Alcoholic liver disease refers to a range of progressive liver condition. In this condition, as the name indicates, the patient is surely an alcoholic progressive liver condition, and how liver is affected in a case of alcohol consumption we are going to discuss about all in this video. So the definition is it's a refers to a range of progressive liver condition caused by chronic patient is taking alcohol from a very long period of time and excessive, and he is consuming a very excessive amount of alcohol consumption. One third of US population consumes alcohol. US population consumes alcohol. So how alcohol, and these one third of people consumes above the recommended level, which increases their risk of alcoholic liver disease. It's usually, let's discuss about its epidemiology. It's the second most common cause of liver cirrhosis. And what happens if a patient develops decompensated cirrhosis? Patient develops liver carcinoma, hepatocellular carcinoma, second most cause of cirrhosis. So you should worry about if you are consuming excessive and chronic amount of alcohol. So let's discuss about its etiology. The main common cause, first cause which I am going to discuss is alcoholism. What is alcoholism? So we were discussing about alcoholism. Alcoholism is a pattern of alcohol use in such a way that causes significant and psychosocial physical and psychosocial impairment. So that's the cause of alcoholic liver disease. So how alcohol causes alcoholic liver disease? Let's discuss about the pathophysiology. This situation is like you take alcohol in the form of ethanol. This liver degrades this ethanol into acetyl CoA. This acetyl CoA is an coenzyme. Its work is to form fatty acid synthesis. It acts as a coenzyme acetoacetyl coacetate. Thing is that alcoholic dehydrogenase enzymes present in liver. Liver has an enzyme called ADH, alcoholic dehydrogenase, which causes ethanol to convert into acetyl CoA. And in this situation, there is production of NADH. In this case, there is excess production of NADH. This NADH, what happens? This NADH acts on dihydroacetone phosphate DHAP. This NADH act on it and convert into glycerol 3 phosphate G3P. It forms 3 G3P. This an excess NADH acts on dihydroacetone phosphate and forms glycerol 3 phosphate. This increase in G3P and this production leads to fatty acid accumulation in liver. You getting my point? These in G3 increase in G3P and acetyl-CoA coenzyme causes an increase in fatty acid accumulation. How it leads to accumulation of fatty acids? It These two factors causes synthesis of triglyceride. Triglyceride synthesis increases using coenzyme and G3P. These triglycerides accumulate in liver and causes liver inflammation. This inflammation, in this condition, liver having excess amount of fatty acid, this condition is called steatohepatitis. So this liver inflammation, as you all know, steatohepatitis leads to accumulation of fats in liver is called steatohepatitis. This condition leads to liver inflammation. Liver inflammation causes hepatic fibrosis. As you students listened my cirrhosis lecture, and sclerosis, where I explained how hepatic fibrosis take place and leads to liver cirrhosis. This fibrosis and sclerosis leads to portal hypertension, and eventually causes cirrhosis. That's how easy the mechanism is. You should all know how a patient presents. This, we are going to discuss this stages how a patient is going to present. First of all, a patient is consuming alcohol. Liver is responsible for degradation. Liver is working effortlessly to make a patient asymptomatic. So, what are the clinical features? Clinical features. First stage, alcohol fatty liver. Mostly patient present asymptomatic. Mostly patients are asymptomatic. When a patient is asymptomatic, how will he present? The next thing he will, if a patient comes, he will say, my upper abdomen feels pressurized. I feel pressure sensation in the upper abdominal area. Next, you ask the patient to remove your shirt. I am going to examine your abdomen. You soft palpated the abdomen. Now you're going to deep palpate. What you find? You will find hepatomegaly. Liver is enlarged, and when you press down on liver, you will check its soft inconsistency. So, in alcoholic fatty liver disease, the liver of patient is soft and large in number. So you ask the patient to leave drinking alcohol. As he regresses after cessation of alcohol consumption, your diagnosis and your treatment plan is confirmed that you are a good doctor. Now, if a patient consume excess alcohol, he will exacerbate his fibrosing and sclerosing features. He will exacerbate his liver failure cause. So he is on risk of acute liver failure or chronic liver failure. So what happens, a patient keeps consuming alcohol, and what will happen to his liver in next stage? His liver become alcoholic hepatitis, in which if patient is in early and mild stages, he may be in a reversible stage. If he presented alcoholic hepatitis advanced stage, it will be irreversible. So what will happen after alcoholic hepatitis? As alcoholic hepatitis is a separate topic, we are going to discuss afterward. What will happen? How this alcohol consumption leads to your liver? First it's become fatty liver, then it become hepatitis, then alcohol related cirrhosis. It's an irreversible stage. It's the final stage of alcoholic liver disease. That's how your one pinch of drink causing you a harmful effect. One after one, one after one, one after one. So how will you diagnose the patient? Diagnostics. We are going to discuss about how you diagnose an alcohol. First of all, you will ask, a patient comes to you and he is saying that I am feeling a upper abdominal sensation, and you are asking him about the history, that how much if he consumes alcohol or not. He says I consume, or she says I consume alcohol, I drink too much, that I drink 5 glasses, 7 glasses, 8 glasses, sometimes I drink 3, 4, 5 beers a day. The thing is that you asked in history that the clinical features to confirm that if clinical features are present or not. You examined his abdomen, you palpated his liver, and you found it soft, consistent liver. Now, how will you diagnose? You will ask for lab diagnosis. You will ask him to run some tests, lab diagnostics. So first of all, LFTs, liver function tests. In alcoholic liver disease, patient presented with these lab diagnoses, patients AST as well as both transaminases are raised. But how will you diagnose, differentiate that it's cause of alcoholism? In alcohol fatty liver disease, AST concentration is higher than ALT. Meanwhile, both are raised, but the concentration of the amount of AST is higher than ALT. So you will run for GGT, gamma glutamyl transferase. It will also be raised. So next test you will go for absorptive ability of liver, serum ferritin level. As liver produces different enzymes, hormones, uh, chemicals, serum ferritin is one of them. In alcoholic fatty liver disease, serum ferritin level is raised, and alcoholism and alcohol consumption and alcohol fatty liver causes macrocytic You will run CBC with peripheral smear. You will find out macrocytic anemia. The cause may be folic acid deficiency or vitamin B deficiency. So you are working in Canada and you have a facility called CDT test, carbohydrate deficient transferrin. It will also be raised. It's a biomarker. CDT is a biomarker of heavy alcohol use. Heavy alcohol use. So you will ask radiologists to run some radiological tests. And what are these radiological tests? I am going to explain here. What are the findings? You will ask a simple ultrasound and what will you find out? There is mild hepatomegaly. Next, due to hepatosteatosis, fatty accumulation on liver, blood vessels cannot be visualized. So you cannot see blood vessels on ultrasound imaging of an alcoholic liver disease. And you will find increased liver echogenicity. More bright surfaces will be appear due to steatosis. And you will ask a CT report, CT scan abdomen and thorax or CT liver with reporting. So next we are going to discuss about the treatment. In short and in simplest way, I am going to explain you the treatment of alcohol liver disease. As the main cause is alcohol consumption, we'll ask the patient if he comes with alcohol liver disease or alcoholic fatty liver disease. We'll ask him to stop taking and stop drinking alcohol completely. In some cases, we consult our pharmacist about glucocorticoids, prednisolone, to treat alcoholic liver disease. Here I am explaining about only alcohol liver disease, not about alcoholic hepatitis and alcoholic related cirrhosis. So it's the main treatment plan is to immediate. Patient comes to you and you ask him, do not ever drink alcohol. Never ever if you wanna live. Make him feel frightened that how much he has damaged his liver. So what kind of complications, how to make him feel frightened about his liver, that what will happen if he keeps taking drinking alcohol, what will happen? Now we are going to discuss about complications. In Pakistan, nobody asks you about the complications. While in USA, UK, Canada, Europe, developed countries, people ask about what will happen, how it will proceed, how this disease will lead to next stage, what will happen to me. While Pakistan, nobody asks. First complication, decompensated cirrhosis. Patient is going to develop decompensated cirrhosis, a very lethargic, very malaise, very dead liver in my words, because decreased hepatic functions. What kind of functions liver is performing? Liver is maintaining blood pressure. So portal hypertension will develop and leads to decompensated cirrhosis. The next decreased hepatic function is development of ascites. fluid accumulate in cavities. Third thing, patient loses his consciousness, hepatic encephalopathy. So, what will happen next? Patient's coagulation factors forming ability loss, coagulopathy. Patient presents with coagulopathy. Patient's kidney functions may alter and disrupt. So patient presents with hepatorenal syndrome. Next thing we have discussed in cirrhosis, especially in male, what will happen? Hormonal change that will act is hyperestrogenism. Large breast in males, hyperestrogenism. Loss of sex drive. How will you survive as a male without a sex drive and libido? Or you will develop certainly later on in your life infertility. What kind of a male develops infertility? Just think about it. If you are having alcoholic liver disease, and you will certainly develop end stage liver disease. So, what other organs? If it affects other organs, what will happen? Alcoholic liver disease can also lead to gastritis. We have discussed in our gastritis disease lecture. Malabsorption, vitamin absorptions will be disrupted. Alcohol affects your pancreas. Patient may present with chronic pancreatitis. So next thing, patient can have Wernicke-Korsakoff syndrome. What is it? Patient presents with confusion, ataxia, and ophthalmoplegia in this condition, and it is due to vitamin B12 deficiency. The next thing, patient can present with Zaev syndrome. The new thing that you are going to learn here is Zaev syndrome. What is it? It's acute hemolytic anemia. After excess alcohol intake of years and years, leading to alcoholic hepatitis, jaundice, and hyperlipidemia. That's all for alcoholic liver disease. If you have any question, you can ask me. Thank you so much.